Hello, my name is Corey Livesey and I'm a senior nursing student at Robert Morris University. Today I'll be presenting my professional portfolio. I'll put the link in the description box. When you go to the link, you'll notice on the left-hand side that there will be a toolbar that you'll be able to scroll through. Through each tab, you'll find different experiences that I have had in different documents showing that. First, I'd like to talk about my resume and my cover letter. All of the resources on this portfolio, I use them to apply for a job in labor and delivery at St. Clair Hospital. Through my coursework, this is where I found I'd really like to work, and it really was my passion. I highlighted different clinical experiences within my resume that really popped and stood out aside from all the other ones that I completed. The ones that I wanted to highlight were that I did a rotation in the PICU at Children's Hospital, and I also completed my clinical rotations at St. Clair Hospital in the labor and delivery unit where I will be working. Along with this, I put some professional experience that I've had. I completed a summer internship in 2019, and that was completed in the emergency department at St. Clair Hospital. I was really lucky because my preceptor actually worked in the labor and delivery unit and had a lot of tips for me, and she was able to give me a lot of advice. Through my internship, I was able to learn how to start IVs, do EKGs, do monitored transports, and insert catheters. This was really helpful whenever I applied for my job because I was already a step ahead and I knew how to complete some things and I didn't need further explanation. This was really important because obstetrics is a specialized field, and typically whenever new grads are entered into the field, they like them to have a little bit of background. So luckily I had that through my internship. After my internship was completed, I stayed in the emergency department at St. Clair, and I worked as an emergency room technician. I did the same exact things that I did in the internship, but I wasn't allowed to give medications under supervision of a nurse. So that was really nice to be able to stay there, and I currently still work there until I graduate. I have listed my skills and certs on my resume as well. Two that really stand out and help me with my job application was PAIRS, and that is pediatric resuscitation. That's really sought for and looked after in the obstetrics field because it is a job requirement. BLS was just a really good thing to have because it also is a job requirement to work at St. Clair Hospital, and having that renewed, it was really good to have that listed. Through all my experiences at that hospital and at my other hospitals that I did rotations at, I really made a point to talk to the unit directors, talk to all the staff members, and I really tried to incorporate myself and become part of the team. I thought that was really important because I felt as if the nurses were more willing to reach out and show me different things whenever I truly was interested and willing to help them get their job done as well. So it was really nice. It went back and forth, so that was good. I met a lady named Mary Hoberg. She was actually one of the unit managers on the Family Birth Center whenever I did my internship. Whenever I did my clinical rotation. I was able to list her as a reference as well as my friend Sam, who was my preceptor in the emergency room. On my portfolio, you'll also notice that I have some presentations listed. They're both on the same topic, and that's the opioid abuse epidemic. This is something that I really had a passion about and really felt was really important for other peer members to be educated on, and just to have that awareness in the back of their mind whenever patients do have problems with addiction. Like I said, this doesn't really fit directly with my career path, but it is something that's really prevalent. You know, there are a lot of mothers who have struggled with drug addiction and whose infants have lasting effects from this. I also did a graduation presentation project on catheter-associated urinary tract infections. This is another thing that applies across the board. Catheters are used in all different settings, acute care settings, long-term settings, and it's something that all nurses should be aware of whenever they're inserting catheters. They should be maintaining sterile technique and really looking after their patients and realizing how the procedure could have harmful effects. I have listed my professional plan for my career development. With this, essentially I would like to work as a nurse, as a registered nurse for a few years, really get my feet wet, get comfortable in all of my skills, and then I'd like to take my education a step further. I would like to go back to school and get my master's degree. With this, I would like to become a ethics professor, or I would like to work in the sim lab. I felt working or taking classes in the sim lab was really nice because there wasn't a lot of pressure. The professors were very understanding, and they really helped you with communication skills, which I felt was really important in every aspect of nursing. I feel like communication is a really, really big thing. So I really enjoyed doing the simulations at school. Ethics was also something that really stood out to me and made me think more than I typically would. Thank you for listening, and I just really want to highlight once again how Robert Morris coursework really helped me become an individual and find where I'd like to go with my career path.